Good afternoon, everybody. Welcome to Sparrow. My name is Joe Ruth. I'm the Chief Operating Officer, and we are honored today to host this news conference. I'm really pleased to see this kind of turnout to discuss caring for the most vulnerable people in the state of Michigan. So thank you for being here. It is my pleasure to introduce to you Mr. Spencer Johnson, the President of the Michigan Health and Hospital Association, to the podium. Spencer?
Thanks. We appreciate Sparrow being willing to host us today. As Joe said, my name is Spence Johnson. I'm the President of the Michigan Health and Hospital Association, which is headquartered here in Lansing. And I'd like to thank everyone, first of all, for being here to support our Medicaid Medicaid Coalition. Michigan has a unique opportunity now to improve the lives of hundreds of thousands of their citizens and save money at the same time. Today we are here to urge our state legislators to help us save lives and save dollars by extending health insurance coverage to thousands of Michigan residents through a federally funded Medicaid Expansion program. As we move along, you're going to hear from other members of the coalition, and they'll be able to give their perspective to you on their particular part of healthcare delivery. Michigan hospitals have long been committed to a mission of accepting everyone, insured or not, to be treated and cared for. Unfortunately, and this question came up earlier from one of the media, how would this benefit hospitals and most importantly benefit their patients? The ER has become the primary access point to healthcare delivery for 1.2 Michiganians who don't have healthcare insurance. And many of these services turn into real emergencies that could have been prevented or improved if they had health insurance and access to routine medical care. Now I'd like to introduce what I consider in healthcare right now for us in Michigan, our Chief Strategic and Policy Officer, Governor Rick Snyder.
Well, Spencer, thanks for that welcome and thanks for what the Hospital Association does. And I want to thank Sparrow for hosting this event today. It's great to be here. And I'm proud to be here with my partners. I'm here with my partner, Lieutenant Governor Brian Calley, Director Jim Haveman, and Budget Director John Nixon. So we've got quite a crew here, but we really crashed this event, if you want to know the truth of it. I want to thank all these outstanding organizations and people for wanting to hold a press conference today. And the reason they wanted to hold a press conference is they wanted to encourage our support for going ahead with expanding Medicaid. We thought there was a simpler answer. We think they're right. So the easy answer is just to join them and say, we're all here to support the expansion of Medicaid, and that's the message I'll be making tomorrow on the budget message. We're trying to show there's a pre-dog year version of things. You can go even faster than dog years. But it's an important thing. And it's not something to joke about because it's about people's lives. When you stop and look at Medicaid expansion, the real issue is how do we give better care at a lower cost? And that's the objective behind all this. And if you stop and look at what the situation involves, this is a case where the numbers show 46% of the uninsured in Michigan will be covered by this in terms of providing healthcare opportunities to them. That's huge. Because as Spencer said, the real issue, when I looked at it, the analysis we went through is their capacity. Because for many of those in the uncompensated care side, those that are uninsured, they're using the emergency room as their primary healthcare mechanism. That's a flawed system. And that's a system we can't sustain either because of the healthcare they're not getting in terms of a primary care model or the cost to our society. So this is a real opportunity to step up and say, let's do a patient-centered medical home model for these individuals. And we're talking hundreds of thousands. We're talking 300 and some thousand to start with, the number growing to almost 500,000 people within a few years, that then can have a patient-centered medical home model to provide better care at a lower cost. and really leverage our entire healthcare system to work together to make that happen. That's an exciting outcome. And that should be the focus that we need to move forward with. One thing I will share with you that I will be talking about more tomorrow is, in the early years of this program, the way the federal government has designed it, it actually will be saving the state of Michigan significant dollars in the range of in excess of $200 million a year. I'm calling for something that traditionally has not been called for. Those savings are not all to be spent. One thing I will be talking about tomorrow is to take half of those savings and to set up a health savings account, just like we would in our family. To say, let's put those dollars aside to save to the future. To use them in the point where we will actually have to start contributing to the cost within a few years. And we have some uncertainty as to where all the federal government may go. But I believe it's prudent to create a health savings account with significant dollars in it that then can offset those costs when the state has to start paying. If you actually model that out, what we've modeled out is it would be before the year 2035 before Michigan would actually have to start putting dollars towards this program if it stayed as is. That's a huge opportunity, again, planning not just for today, but for a future that's bright for all Michiganders in providing better health care. So that's something I would share with you. The other thing I would say is this is very exciting today. I think this is an important step in Michigan in terms of moving forward with care for people that need it. But I would also say this is not the stopping of the efforts that we need to continue in healthcare. There are a number of other things. I'll be talking about some of those tomorrow, or the Lieutenant Governor will in our budget message. We need to keep working healthcare issues, mental health issues, the whole spectrum of different issues. So I don't view this as the end point by any means. This is an opportunity to continue to give better care to Michiganders. But in that context, let's stop for a minute and say, what is this all about? It's a win for all. It's a win at the individual level for the person that currently does not have insurance, that's currently being forced to go to an ER. They're not getting the help. They're not having the opportunity to have the livelihood that they could otherwise have if they were in a patient-centered medical home. The important thing from the societal level is that we look at that and say that's valuable by its own right, and that's important. But we have a bigger obligation also to say, let's build a smarter system around that. And so it's just not about getting care, but getting better quality care and thoughtful care and preventative care so they can avoid those ER visits or those very expensive processes because we're doing preventive medicine. So let's work together as a team. And the best part is I appreciate Spencer's introduction, but the real healthcare team's standing right here on both sides of me. And so I'm going to turn it over to the experts. Now I'll be happy to help answer some questions. But we have a great group of professionals that can speak to how well the system can work, and I think they're excited by it. So I'm going to turn it over. Kim?
Great. Thank you. Thank you, Governor. Good afternoon. I'm Kim Spilsky. I'm the Executive Director of the Michigan Primary Care Association. We are the statewide association of community health centers serving over 600,000 Michigan residents in over 220 delivery sites throughout the state. The Michigan Primary Care Association and Michigan's community health centers applaud Governor Snyder for recommending the expansion of Medicaid for more Michigan adults, most of whom are working in low-wage jobs without health insurance. As Michigan's largest network of safety net providers, health centers are in Michigan communities delivering care to people in greatest need of health care and human services. Every day, health center providers see patients who have delayed seeking care because they have no insurance. And these people are suffering with health conditions that could have been prevented or made less painful. With early and appropriate care, the cost of care can be greatly reduced. And evidence shows that children of parents with coverage seek and receive more and better care. Expanding Medicaid will also allow health centers to care for more people who lack a primary care provider. Research shows that having a regular source of health care keeps people healthy, out of the emergency room, and results in improved quality of life and productivity. We're pleased to work with our coalition partners in urging Michigan's legislature to support Governor Snyder's recommendation to accept the federal government's offer to pay for expanding Medicaid in Michigan. Expansion is a major step towards ensuring all Michigan residents have access to comprehensive, affordable health care. It will improve the quality of life for Michigan families. It will save the state money, and it will drive down the long-term costs of our healthcare system. Michigan's federally qualified health centers stand ready and have capacity to care for Michigan's uninsured. And we are eager to serve those soon to be Medicaid eligible, working adults and families that are our neighbors and friends. Thank you for this opportunity.
Well, thank you, everybody. I'm Dr. Ken Almasian, and I'm President-elect of the Michigan State Medical Society. And I want to thank the Governor, and especially Director Haberman as well, their bold vision on where we're going in this direction. You know, the bottom line is everybody deserves good, quality health care. And that is something that I think we can deliver here in Michigan by expanding the Medicaid program. As physicians, we know in particular that those without insurance frequently delay their care. And by doing so, they end up being sicker, going to the emergency room, which is a highly inefficient and cost-ineffective way to take care of the people of the state. Prevention, early detection, and treatment are far better prescription than procrastination. Making people sicker and driving healthcare costs up is something we all need to be against. If we reject this, I'm afraid we're going to take steps backwards. And we'd be faced with the same problems we have today. That would be about 1 million people uninsured. It would be a severe lack of our mental health services and an abysmal Medicaid rate that continues to hinder access to current Medicaid recipients. As a medical society, and it's been alluded to, we have the capacity to take care of that. There's been some recent data showing that our physician-led healthcare teams are able to handle that capacity, and we're willing to certainly enthusiastically do so. I don't think we have a choice here. I think there's an important opportunity for us, and I think we need to move forward with this. And again, I applaud the Governor and the Director for their vision. Thank you very much.
Good afternoon. My name is Michael Visna, and I'm the Director of the Michigan Association of Community Mental Health Boards, representing the 46 community mental health boards and 65 provider organizations which deliver mental health, substance use disorder, and developmental disabilities services across our entire state. On behalf of our members, I want to thank the organizers of this press conference for the opportunity to speak to the importance of Medicaid expansion to improve access to mental health and substance use disorder services in our state. Due to the recent tragedy in Newtown, Connecticut, improving our state and national mental health services has taken a much needed front seat in policy and budget discussions. In his State of the State address, Governor Snyder called for an increase in mental health awareness efforts and increased support for prevention and early intervention efforts. The House Republican Action Plan, announced last week, called for solutions to address barriers to accessing mental health systems. That same plan further states that House Republicans will continue to encourage a more uniform mental health services program statewide so that citizens can rely on the same quality services county to county. We want to thank the Governor for his support of Medicaid expansion, and we urge the legislature to consider. If you want to provide increased support for mental health services, if you want to remove barriers to accessing quality mental health services, And if you want to provide more uniform mental health services statewide, expand Medicaid. Cuts to general fund support for mental health and substance use disorder services over the past decade have resulted in a lack of access, reduction of services, and creation of waiting lists for persons without Medicaid. As a result, persons with emerging mental health and substance use disorders are not seen for care and instead end up in emergency room and hospital settings, law enforcement and criminal justice proceedings, and in some cases, homeless on the street. Settings where they do not belong and settings which are not equipped to provide the types of mental health and substance use disorder services they need. So again, we urge the legislature to consider, if you want many of these individuals out of these settings and instead in community-based mental health and substance use disorder services with providers trained to address their problems more effectively and more efficiently, expand Medicaid. As is the case with physical illnesses, prevention and early intervention treatment for behavioral health disorders is the most cost-effective care. Expand Medicaid. It will save lives and it will save money. Thank you.
Good afternoon. I'm Rob Fowler, President and CEO of the Small Business Association of Michigan. We have about 18,000 members all across the state, and we've been involved in health policy for over 40 years. When I was a boy, I remember sitting in a doctor's office reading the magazine called Highlights. I think they still have it. And in the Highlights there was a puzzle. The puzzle was a picture, and the question was, what doesn't belong in this picture? As I think about what doesn't belong in this picture, it might be me. The Small Business Association of Michigan endorses the expansion of Medicaid, and I'll tell you why. I consider it kind of an organizational epiphany about a decade ago, where we came to realize that the uninsured really matter to business. And whether we have thought of that, directly or not, it became pretty clear to us how it works. And this is how it works. People get care, they go to our healthcare system and they get care. And if they can't pay for it, they still get care, but it becomes uncompensated care. Uncompensated care actually gets passed along to those who can pay. It's called cost shifting. It's been happening for a very long time. It's found its way into the base rates of health insurance for small businesses all across the state. And I would say it's a terrible business model, that we take a growing burden of people who come without compensation and we shift it to a shrinking group of people who struggle to pay for health insurance. Whether you supported Obamacare or not, and we did not, one of the main elements of it is everybody in. And everybody in a system of healthcare with some form of payment is better for those who have had costs shifted to them for many, many years. We support this because we believe it ultimately can have, can reduce the sort of piling on effect of cost shifting that's been happening to paying customers for many years. So we'll be there in support of Medicaid expansion. Thank you.
Good afternoon. My name is Chris Nikoloff. I'm the Executive Director of the 8,000-member Michigan Osteopathic Association. We represent physicians, surgeons, students, and residents. We're the fastest growing osteopathic association in the country, and we're the largest. We have the #1 osteopathic medical school right down the street here at Michigan State University. We're very proud of that, and we know that we have the people to deliver the care. First and foremost, we have to have the people. We have the healthcare professionals. Now we need to make it work. The way to make it work is expand Medicaid. This is an opportunity. I look around here, I see a lot of familiar faces going back almost 30 years. 30 years I have been, along with most everybody here, lobbying the legislature to expand Medicaid services and funding. This is the most exciting opportunity that I've experienced in my life. How can't we do this? $2 billion a year, $30 billion over the next decade. 100% coverage that $2 billion will pay for the next 3 years, and then after 2020, it's 90%. This is simple. Just do it. This is the right thing to do. The right thing to do, the best opportunity that's come our way in 30 years that I can think of. 450,000 people will get coverage that don't have it right now. Now, you've been to University of Michigan's football stadium? 4 times that. Picture that right now. 4 times that full of patients that will receive care if we expand Medicaid. Please expand Medicaid. Thank you.
Good afternoon. My name is Rick Murdoch. I'm the Executive Director of the Michigan Association of Health Plans, representing 16 health plans that serve about 2.5 million citizens in this state through Medicare, commercial, and Medicaid products. I'd like to acknowledge with me today is Scott Wilkerson, who's with PHP's own health plan that serves Medicaid and is also CEO of the health insurance plan of Michigan serving the high-risk population. One of the key issues is access to care and quality of care. Michigan has been a national leader in Michigan in Medicaid managed care. Our members are constantly rated among the best in the country. In fact, the last rating from Consumer Reports, NCQA, was that 10 of the top 50 Medicaid plans are from Michigan and 6 of the top 25. Credit goes to the Department of Community Health for their administration of a contract with expectations of high performance and outcomes, and credit goes to our members for their innovation and services to the Medicaid beneficiaries. I say that because, as other speakers have noted, we are ready and prepared for expansion. The recent survey by MSMS and the University of Michigan, coupled with the research that our association has done, will demonstrate that the capacity to absorb the additional population from expansion is there. We don't have to build new systems. We don't have to create new policies or change contractors. We are ready for expansion. We expect most, if not all, of the expanded population will be enrolled in the Medicaid health plans, and our members are prepared for the expanded enrollment. If we do this, rather than receiving services in the hospital emergency department, Medicaid expansion provides the means to provide a medical home, access to needed primary care services, provision of timely preventive health care, and it will help to reduce the overall health care costs, including reducing the so-called hidden tax of uncompensated care that Rob talked about earlier. As we go forward after today, we intend with our partners here to work closely with the administration and the legislature to discuss how this investment will not only hold down costs, reduce the current uncompensated cost, as I mentioned, but will also improve Michigan's overall health status. I want to thank the governor for his announcement today, and I want to thank Sparrow for holding this press conference today so we could jointly and enthusiastically support Medicaid expansion. Thank you.
Good afternoon. I'm Jacqueline Morrison, State Director for AARP Michigan. I suppose I could just say ditto, but I won't. First, on behalf of our 1.4 million members who are today represented by Bill McCarty of Portage, we want to thank Governor Snyder. This is an exciting day for us. And I'm here to express our support and to urge our legislators in the state of Michigan to expand Medicaid coverage to Michigan residents with incomes up to 133% of the federal poverty line. It's clear from what we've heard so far today that Medicaid expansion will both save lives by expanding access to health care for people who desperately need it and save money. This issue is important to AARP because it is critically important to those between the ages of 50 and 64 who are not yet eligible for Medicare and have no health insurance coverage. In Michigan, during our country's economic recession, there were many 50 to 64-year-olds, through no fault of their own, who lost their jobs, lost their employer-paid health coverage. They now find themselves either looking for a job or struggling in low-wage jobs where they receive no health benefits and cannot afford to buy it on the market. The AARP Public Policy Institute analysis indicates that 12.2% of Michigan's population aged 50 to 64 is uninsured. The Institute further projected that expanding Medicaid as proposed will provide health coverage to an estimated 75,000 uninsured Michigan residents between the ages of 50 and 64. So expanding Medicaid will help tens of thousands of those in this age group in Michigan who lost their jobs through no fault of their own, struggling in low-wage jobs, without health benefits, don't qualify for Medicare, and we all know someone like this. We all know someone like this. They're in our communities. They're in our churches. They're in our families. In my case, it's a sister with diabetes. They've paid in all their lives, but are now struggling to make ends meet and stay healthy. Older adults are particularly vulnerable to deterioration in function and health status if they do not have access to quality health care. And the ages between 50 and 64, preventive care at this point is more important than ever. I'm a witness. This is the time to catch those potentially debilitating chronic diseases that cause costly emergency room visits and even premature death. But there's something that we can do in Michigan, and so AARP is encouraging our state to do the right thing. Pursuing Medicaid expansion will save our state money, and that makes sense. Pursuing Medicaid expansion will save lives. That too makes sense. So Medicaid expansion is the right thing to do, both for the people who provide health care and for the people who need quality care access but currently lack it. We strongly support and urge the state of Michigan to participate in Medicaid expansion because it's the right thing to do and it just plain makes sense. So thank you, Beth.